Bad breath, also known as halitosis, is a common issue that affects people of all ages. While it can be embarrassing, it's important to understand that everyone experiences it at some point. In this video, we'll explore what causes bad breath, when it might be a sign of something more serious, and what you can do about it. Let's start by looking at why bad breath happens in the first place and how you can recognize if it's just a temporary problem or something that needs medical attention. Bad breath is an unpleasant odor coming from the mouth. It can be temporary, like after eating certain foods, or persistent, which may indicate an underlying issue. Most people notice bad breath when talking closely with others or after waking up in the morning. Understanding the difference between occasional and chronic bad breath is key to knowing when to take action. One of the most common causes of bad breath is the food we eat. Foods like garlic, onions, and certain spices contain strong-smelling compounds that are absorbed into the bloodstream and carried to the lungs, where they affect the air you exhale. These odors can linger long after eating, but they usually fade as the body processes the food. Brushing your teeth or using mouthwash can help, but sometimes only time will fully eliminate the smell. Not brushing and flossing regularly allows food particles to remain in your mouth, promoting bacterial growth between teeth, around the gums, and on the tongue. These bacteria produce sulfur compounds that cause unpleasant odors. Good oral hygiene is essential for preventing bad breath. Brushing twice a day, flossing, and cleaning your tongue can make a big difference. Saliva helps cleanse the mouth by removing food particles and bacteria. When your mouth is dry, either from dehydration, certain medications, or sleeping with your mouth open, bacteria can thrive and cause bad breath. Drinking water and chewing sugar-free gum can stimulate saliva production and help keep your breath fresh. Many people notice their breath smells worse in the morning. This is because saliva production slows down while you sleep, allowing bacteria to multiply. Morning breath is usually temporary and improves after brushing your teeth and drinking water. If it persists throughout the day, it could be a sign of another issue. Smoking and using other tobacco products can cause bad breath. Tobacco not only leaves its own odor, but also increases the risk of gum disease, another source of bad breath. Quitting tobacco is one of the best things you can do for your breath and overall health. Alcohol can dry out your mouth, reducing saliva production and creating an environment where bacteria thrive. This can lead to bad breath, especially after a night of drinking. Limiting alcohol intake and drinking water alongside alcoholic beverages can help reduce this effect. Certain medications can cause dry mouth as a side effect, which in turn can lead to bad breath. If you notice persistent dryness and bad breath after starting a new medication, talk to your doctor or pharmacist. They may be able to suggest alternatives or recommend ways to manage the dryness. Cavities and tooth decay provide a place for bacteria to hide and multiply, leading to persistent bad breath. Regular dental checkups and good oral hygiene can help prevent cavities and the bad breath that comes with them. Gum disease, also known as periodontal disease, is a major cause of chronic bad breath. It occurs when plaque builds up on the teeth and gums, leading to infection and inflammation. The bacteria involved produce foul-smelling compounds. Treating gum disease early is crucial for both your breath and your overall oral health. A coated tongue can be a significant source of bad breath. Bacteria and food particles can accumulate on the surface of the tongue, especially towards the back. Using a tongue scraper or brushing your tongue gently can help remove this buildup and improve your breath. If you wear dentures, braces, or other dental appliances, they can trap food particles and bacteria, leading to bad breath. Cleaning these devices thoroughly every day is essential to prevent odor and maintain oral health. Infections in the sinuses, throat, or tonsils can cause bad breath. These infections often produce pus, which has a strong odor. Treating the underlying infection with appropriate medication can help resolve the bad breath. Tonsil stones are small, hard deposits that form in the crevices of the tonsils. They are made up of bacteria, dead cells, and mucus, and can cause very foul-smelling breath. Gargling with salt water and maintaining good oral hygiene can help prevent tonsil stones. Problems in the respiratory tract, such as bronchitis or chronic sinusitis, can also contribute to bad breath. These conditions often involve excess mucus, which can harbor bacteria and lead to unpleasant odors. Treating the underlying respiratory issue is necessary to improve breath. Sometimes, bad breath can originate from the digestive system. Conditions like acid reflux or gastrointestinal infections can cause odors to travel up from the stomach to the mouth. If you have persistent bad breath along with digestive symptoms, it's important to consult a healthcare professional. Certain systemic diseases, such as diabetes, liver disease, or kidney failure, can cause distinctive types of bad breath. For example, a fruity odor may indicate uncontrolled diabetes, while a fishy smell could be a sign of kidney problems. These conditions require prompt medical attention. Most cases of bad breath are harmless and temporary. However, if your bad breath is persistent, doesn't improve with good oral hygiene, or is accompanied by other symptoms like pain, swelling, or unexplained weight loss, it could be a sign of a more serious health problem. In these cases, it's important to seek professional advice. Certain symptoms alongside bad breath should prompt you to see a doctor. These include persistent mouth sores, painful or bleeding gums, loose teeth, difficulty swallowing, or a metallic taste in your mouth. These signs could indicate infections, gum disease, or even oral cancer. In rare cases, persistent bad breath can be a symptom of oral cancer. Oral cancer may also present as a sore that doesn't heal, a lump in the mouth, or difficulty chewing. Early detection is crucial, so don't ignore these symptoms if they persist. Dentists and doctors use several methods to diagnose the cause of bad breath. They may ask about your medical history, perform a physical exam, and sometimes use special instruments to measure the strength of your breath. Identifying the underlying cause is the first step to effective treatment. If you're concerned about your breath, you can try a simple self-test. Lick the inside of your wrist, let it dry for a few seconds, then smell it. If it smells unpleasant, you may have bad breath. However, this is only a rough guide, and a dental professional can provide a more accurate assessment. Maintaining a consistent oral hygiene routine is the best way to prevent bad breath. Brush your teeth at least twice a day, floss daily, and don't forget to clean your tongue. Replace your toothbrush every 3 months, and visit your dentist regularly for checkups and cleanings. Mouthwash can help freshen breath, but not all mouthwashes are created equal. Some only mask odors, while others contain antibacterial agents that target the root cause. Look for mouthwashes with ingredients like chlorhexidine or cetylpyridinium chloride for best results. A balanced diet can help prevent bad breath. Eating plenty of fruits and vegetables increases saliva flow and helps clean the mouth. Avoiding excessive sugar and processed foods can also reduce the risk of cavities and gum disease, both of which contribute to bad breath. Drinking plenty of water throughout the day helps keep your mouth moist and washes away food particles and bacteria. Carry a water bottle with you and take sips regularly, especially if you're prone to dry mouth or talk a lot during the day. Chewing sugar-free gum can stimulate saliva production, which helps wash away bacteria and food particles. Choose gums with xylitol, a natural sweetener that also helps fight bacteria. Avoid sugary gums, as they can contribute to tooth decay. Quitting smoking and limiting alcohol intake are important steps for fresh breath and overall health. Both substances dry out the mouth and increase the risk of gum disease, which can cause persistent bad breath. If you have a medical condition that contributes to bad breath, such as diabetes or acid reflux, managing the underlying disease is key. Follow your doctor's advice, take medications as prescribed, and attend regular checkups to keep your condition under control. If you've tried improving your oral hygiene and bad breath persists, it's time to see a dentist. Dentists can check for cavities, gum disease, and other oral health issues that may be causing the problem. Early intervention can prevent more serious complications. If your dentist rules out oral causes and you still have bad breath, consult your doctor. Persistent bad breath can sometimes be a sign of systemic illness, such as diabetes, liver, or kidney disease. Your doctor can run tests to identify or rule out these conditions. Children can also experience bad breath, often due to poor brushing habits or mouth breathing. Sometimes, a foreign object stuck in the nose can cause a sudden foul odor. Encourage good oral hygiene and consult a pediatrician if the problem persists. Older adults may be more prone to bad breath due to dry mouth, medications, or dental issues. Regular dental visits, staying hydrated, and managing medications can help reduce the risk. Family members should be supportive and help monitor oral health. Bad breath can affect self-confidence and social interactions. People may avoid conversations or feel anxious about their breath. Addressing the underlying cause and maintaining good oral hygiene can help restore confidence and improve quality of life. There are many myths about bad breath, such as the belief that mouthwash alone can cure it or that only poor hygiene is to blame. In reality, bad breath can have many causes, and effective treatment depends on identifying the specific reason in each case. Recent research suggests that probiotics may help balance the bacteria in your mouth and gut, potentially reducing bad breath. Eating yogurt or taking probiotic supplements could be beneficial, but more studies are needed to confirm their effectiveness. Some natural remedies, like chewing parsley, drinking green tea, or rinsing with baking soda, may help neutralize odors. While these can provide temporary relief, they should not replace proper oral hygiene or medical treatment when needed. Regular dental checkups are essential for catching problems early and maintaining fresh breath. Your dentist can spot issues you might miss and recommend treatments tailored to your needs. Don't skip your appointments, even if your mouth feels fine. People with braces, dentures, or other dental appliances need to pay extra attention to cleaning. Special brushes, floss threaders, and cleaning tablets can help keep these devices free of bacteria and odor. Ask your dentist for personalized advice. Traveling can disrupt your oral hygiene routine, leading to bad breath. Pack travel-sized toothbrushes, toothpaste, and floss, and try to stick to your regular cleaning schedule. Drinking water and chewing sugar-free gum can help when you're on the go. Seasonal allergies can cause nasal congestion and mouth breathing, both of which contribute to dry mouth and bad breath. Managing allergies and staying hydrated can help reduce these effects during allergy season. To sum up, bad breath can have many causes, from food and poor hygiene to medical conditions. Most cases are temporary and can be managed with good oral care and healthy habits. However, persistent or severe bad breath may signal a more serious issue, so don't hesitate to seek professional help if needed. Bad breath is a common problem, but it doesn't have to control your life. By understanding the causes and taking proactive steps, you can keep your breath fresh and your confidence high. Remember, good oral hygiene and regular checkups are your best defense. Thank you for watching. Remember, fresh breath is a sign of good health. Take care of your mouth, stay hydrated, and don't hesitate to seek help if you notice persistent problems. Your smile and your breath are worth it.